So, first of all, I am thankful to the organizers for giving this opportunity to share my views as a private practitioner, perspective for roadmap for Ayurveda in 2047. So, I am a private practitioner. I am actually swimming in the ocean. So, whether I will go down or swim for till 2047, that I want to discuss with you. So, first let us pray God Dhanvantari with the blessings of all gurus, Purva Vidyas and Apurva Vidyas. So, as a practitioner, Vaidya, what happens? Patient comes to us with the linga, Hetu Linga Ushadam Jnanam. Patient comes to us with all signs and symptoms. We have to find out what is its Hetu, cause. To that cause we have to treat. So, the logic of analyzing cause in Ayurveda is according to three doshas. Nasti rogo vina dosha. Nasti arogo also vina dosha. When doshas are in samavastha, there will be aroga. When doshas are in vishamavastha, there will be roga. So, that is why Sushruta says samadosha samadatmala kriyaha prasannatmendri manaha swasthya vidhiyati. Samadosha means what? This question arises. Usually I ask all the students to come to my hospital, what do you mean by samadosha? Everyone tells, sorry, why it does not go back? Yeah. So, no one could answer. Last 25 years, I think I trained more than 3,000 students. No one could answer what do you mean by samadosha. So, they say vata pitta kapha sama. Is it dravyatah, kunatah, karmatah? So, how many doshas are there? According to Ayurveda, there will be dvida doshas. Dvida vatadaya, prakrita vata pitta kapha and vaikrita vata pitta kapha. What is prakrita vata pitta kapha? It is the causative for formation of the body. They are called as three dhatus. They are bija surupa for vaikrita vata pitta kapha. So, they do not decrease or increase from birth to death. At the time of birth, sir, even though all three doshas are in each individual, according to prominence of dosha, you call vata prakriti, pitta prakriti, kapha, dvidosha, sannipata prakriti. That is prakriti of the individual person. How much vata pitta kapha should be there in a given individual is decided by permutation combination of percentage of vata pitta kapha in shukra, artava, ahara, rasa and kala. So, this is prakriti of the person. Actually, this concept is based on a geometry. In geometry, if a given circle, if you do a triangle, vata pitta kapha, if a human being is a 46 chromosomes, 46 centimeters diameter circle, you do 600, 700 billion people, 700 billion triangles. Each triangle will have its own perimeter or area. You see, it may be vata pitta kapha. A maximum a dosha in a person will be 50%, not more than that, because circle will broke. So, when we see in a civil engineer office, if you see its a perimeter, as told in Vagbata, samadosha is shrestha, ekadosha is nindya, whereas dvidosha is madhyama. It's a perimeter, you see, it's a mathematically proved. It's a geometry. Ayurveda is a mathematical based science. It is not biology, it is a mathematical based. On this basis, we all, then comes what is Vaikrita, Vata, Pitta, Kapha. Vaikritastu, how it is formed? Mother takes food, it goes to womb, then Pachana occurs, Amaswarupa, Malaswarupa, you get Vata, Pitta, Kapha. How much it should be formed? It must be formed up to the extent of Prakrita, Vata, Pitta, Kapha. After Te Kaladivashena, if Swapramana, that much it is formed, that is health, anugraha, it does all the functions in the body. Which one? Vaikrita vata pitta kapha. Whereas if it is ruddhiksha yogat, it causes all the diseases in the body. That is why health means if V1, P1, K1 is Vaikrita vata pitta kapha, V plus P plus K is Prakrita vata pitta kapha, health means V plus P plus K equal to V1 plus P1 plus K1. So, by kahalartha karmana yoga hinyam ithyadi matraka, all these causes This Vaikrita, Prakrita will not change. If it is changed, that is the death of a person. This Vaikrita Vata Pitta Kapha increase or decrease causes a disease. As a Vaidya, sitting in a clinic, how this Prakupita Vata, Samuthana, how it increases, why it increases, I have to analyze. Where it has Sthana Samshaya, Adhisthana has happened, all three things you should increase. That is why Charaka says, Vikara Prakriti, which dosha involved in a given Vyadhi. How this has increased, where its Sthana Samshaya has happened. As in a 21st century Vaidya, I should utilize all modern available diagnostic or curative all techniques. I should analyze this Vikara Prakriti, which how it has increased, where its Sthana Samshaya has happened. That is why, so for a, it is a diagnostic purpose, in the treatment purpose also, in Ayurveda we say Shamana and Shodhana. If it is increased, you should decrease, decrease, increase. That is Shamana or Shodhana you do. Then initially there was Kashtaushadis in Samhita Kala. Then Rasaushadhi is adopted in India. Then in 21st century, we have all the battery of drugs from modern medicine, because patient comes with all drugs. We should know how it works according to Ayurveda. That is why in Chakradatta he says, Dimbasta Savirastu, Vatapitatmana, Kshinadadvaratasya, Vatapitatmanasya, very severe condition, Amopi Stambaniya. If you Pachanat Marana Bhayat, if you wait for Amapachana, patient may die. So in that state, he says, if you see all modern medicines, except antibiotics, all are Ramastama like analgesic steroids, receptor blockers. When drug is there, symptom is suppressed. When drug is removed, there is a symptom. When it is in a Atyayika Avastha or Yapya Avastha, we have to utilize in the time of emergency or in the time of a treatment. Or patient comes with this drug. They come, if in every person's home, in all population, there is a paracetamol. Before coming to us, they take a paracetamol, they come. We should know how it works. According to Ayurveda, it is a Amastambana Dravya. So, for a with this input, for a 2047, there should be a primary level practitioners, secondary level practitioners, tertiary level practitioners. Primary level practitioners will be able to treat primary level diseases as a preventive, curative or suppressive when a severe condition. Then they has to refer to a necessary doctor, a physician. For this, practice should have integrated knowledge of all the system of medicine which we are practicing. In a secondary level, Ayurveda only, if they refer to Ayurveda doctor, they should have Ayurveda knowledge specific, or if a modern medicine you refer, they should have their own refer. In tertiary level, yes, disease specific speciality, as Dr. Pense has told, there will be disease specific knowledge. This should be always a this should be always a disease specific. Everyone should have knowledge. You should not think a single level physician should treat. In a primary level, he is a family physician, a basic level physician. He should have all the knowledge. Then he should be referred. That referred second level will have specific level of knowledges. This is how. Then when they get the same number of patients, same patients of different disease, you will have same disease, different patients. You will have taratama bhava bheda of dosha can be understood. Then he can give a specific treatment. This is why we should have such a practitioner. To achieve this, in the academic level, there should be training in both system of medicine, like anatomy, physiology, pathology, pharmacology. You can ask why pharmacology, because patient comes with all the drugs without knowing how it works, how we can treat, whether I should withdraw this drug or should I give Ayurveda drug. Without knowing, if I withdraw, there may be some event may happen to the patient. We should know. Then all basic, this is for about 3 years, they should have basic level knowledge. Then clinical application level with the knowledge of Trivida Bodha of 3 doshas, you should Trivida Bodha of with you should analyze Samuthana Vishesha, Adhisthana Vishesha and Vikara Prakriti according to three doshas, all modern advanced diagnostic treatment techniques you should analyze to understand Trivida Bodha of Tridosha in the Samuthana Vishesha and Adhisthana and Vikara Prakriti. You should utilize all these knowledge, we should go forward. So, as a specialization, it should be trained to specific diseases by Guru Shishya Parampara in post graduation level. Then individual diseases also, I think already there is a in a traditional practice all over India, if you see there are specific specialists are there. Pakshagata specialist is there, bone specialist is there, Visha specialist is there. If you go to the society, it is there. But why can't you train the students in that speciality in specific areas? Then they will be, this primary level practitioner can refer to such a practitioners. Then you can in a 2047, I think we have all these practitioners. In authorities level, very important thing, there should be legal provisions to utilize modern advancement, Ayurveda diagnosis, modern advancements like modern techniques and in the both treatment aspect, diagnosis aspect, in a basic level practice and in the researchers level to understand modern advancement on the basis of Ayurveda Tridosha concept. Whatever researchers what we think today, what is happening is on the basis of modern bioscience researchers. What I am saying, on the basis of this Tridosha concept itself, this modern researchers should be developed. Even Sushruta has told Satata Adhyana, Vadaha, Paratantravalokam, there should be a researchers was taking place in the certain time of Sushruta also. All the things, every knowledge perspective, this researcher should happen on the basis of this utilizing the Tridosha concept in the Trivida Bodha. Then a very important thing is Acharya Seva by Guru Shishya Parampara. Like that, you can develop the knowledge in the society. You can have the knowledgeable physicians in a disease specific or a second level system specific and primary level family physicians. Like that, we can develop health system of Ayurveda, also whole system, health system of India. So, I am very thankful to giving this opportunity to share my opinion to the organizers. With this, I am very thank you very much.